Veins are also classified similar to arteries into large size, medium size, and small veins or venules. Large sized veins as superior vena cava, inferior vena cava, common iliac and portal veins. Structure of inferior vena cava. It has thin wall and wide lumen. It has thin tunica intima, media, and very thick adventitia. Tunica adventitia contains, besides the usual loose areolar connective tissue, bundles of longitudinal smooth muscle fibers, together with small blood vessels, vasa vasorum. Medium-sized vein. It has a thin wall and a wide lumen. Its wall collapses after death, so it appears flattened. Tunica intima is thin and folded, forming the valves. Tunica intima is lined by simple squamous epithelium or endothelium and rests on subendothelial layer which is poor in elastic fibers. Internal elastic lamina is indistinct. Tunica media is thin, poor in elastic fibers, while tunica adventitia is thick and rich in collagenous fibers and blood vessels and nerves. Small veins and venules. They are similar to arterioles, have very thin tunica intima, media, and adventitia. In small venules, tunica media is missing and there is very thin tunica adventitia. Comparison between medium-sized artery and vein. For easy differentiation between both, we have to consider the general characters and the structure of each. Medium-sized artery has thick wall and a narrow lumen, while medium-sized vein has a thin wall and a wide lumen. Medium-sized artery does not collapse after death, and the lumen contains no blood, while medium-sized vein, its wall collapses after death, and the lumen may contain blood. Medium-sized artery has no valves, while medium-sized vein have valves formed of folds of the tunica intima. Structure. Tunica intima of medium-sized artery is thick relative to the vein, and its subendothelium is rich in elastic fibers. There is clear internal elastic lamina. Tunica media of the artery is thick and made of smooth muscle fibers and scattered elastic fibers. External elastic lamina is usually prominent. Tunica adventitia of the artery is narrow, rich in elastic fibers, and contains blood vessels and nerves and lymphatics. Structure of medium-sized vein. Tunica intima is thin and its subendothelium is poor in elastic fibers. It has no internal elastic lamina. Tunica media is thin, poor in elastic fibers. It has no external elastic lamina. Tunica adventitia of the vein is wide and rich in collagenous fibers.
Valves are present only in veins. They are crescentic folds of intima composed of elastic connective tissue and are lined on both sides by endothelium. Valves prevent the blood flow in the opposite direction, regurgitation. They are absent in portal and cerebral veins.
Arteriovenous Anastomoses. These are direct connections between arteries and veins. In certain localities of the body, as tip of the tongue, tip of the nose, lips, eyelids, skin, thyroid gland, penis, placenta, and endometrium of the uterus. Structure. Direct connection. The part connected with the artery has the same structure as the arteriole, while near the vein it has the same structure of the venule. Indirect connection or glomus. It is an organized structure where the arterial branch enters and undergoes the following changes. It becomes convoluted or branched, the internal elastic lamina is lost, the elastic tissue is reduced, and the muscle fibers of the media are replaced by myoepithelial cells. The adventitia becomes wider. Thus, the artery becomes similar to the vein. Functions of the arteriovenous anastomosis. Regulation of the body temperature. As in the skin, they dilate on exposure to cold. Regulation of venous return and the blood flow in the organs. Regulation of digestion, absorption, and secretion in the digestive system.
The heat loss. The reverse occurs in hot weather. They constrict to allow the blood to pass through the capillary bed, thus allow more heat loss. Regulation of venous return. When they dilate, the venous return is increased, and the reverse occurs when they constrict. Regulation of blood flow in the organs and the amount of blood flow during menstrual cycles. Regulation of digestion, absorption, and secretion in the digestive system. Common lesions of blood vessels. Atherosclerosis. Atherosclerotic lesions are progressive and gradual changes occurring in the blood vessels from birth till death. The coronary artery is the earliest vessel to suffer these changes at about 20 years, while other arteries show such changes begin at 40 years. Atherosclerotic lesions are characterized by focal damage to the endothelium. So, fats, cholesterol, platelets, cellular waste products, and calcium and other substances are deposited in the artery wall. These are smooth muscle cells and macrophages. In severe cases of lesions, smooth muscle cells and macrophages became heavily loaded with lipids. These cells are called Schwann cells and form the fatty streaks and plaques seen in the vessel wall. Aneurysm. It is outward bulging or dilatation of the blood vessel wall due to weakness of the media caused by embryonic defect, disease, or lesion. They may rupture and cause bleeding or may compress adjacent areas. Ehlers-Danlos Syndrome. It is a genetic deficiency of the synthesis of type 3 collagen, causing weakness of the vessel wall. The main cause of death in such cases is spontaneous aortic rupture from multiple aortic aneurysms. Obstruction. The vessel is obstructed either partially or completely by a thrombus. Obstruction of end arteries result in necrosis, which is death of tissues from lack of oxygen and nutrients. These infarcts occur commonly in the heart, kidneys, cerebrum, and certain other organs.